New this week, a British group is releasing their list of best foods for easing chronic constipation. They say this is the first evidence-based list and it could help millions of people.
9 News medical expert Dr. Payal Kohli is with us this afternoon to talk about the issue. Let's start with the basics. How common is chronic constipation?
Extremely common, guys. So 1 out of 5 Americans at any given time are constipated, and usually 1 out of 10 kids are constipated as well. And interestingly, older people, as you can imagine, more likely to get constipated, but also women more likely to get constipated for reasons we don't completely understand. Obviously, constipation is a function of what we eat, the bacteria in our gut, but also stress, because it's nerves that move our stool along. Our colon squeezes with nerves, and if we're very stressed out, it can affect our stool either through constipation or through diarrhea by affecting those nerves that supply the colon.
Yes,
Right?
It's the worst. I'm 1 of 5, TMI, but let's talk about it. Oh my God, yes.
Chronic constipation.
Yes,
Yeah.
It's the worst. But so let's talk about these new guidelines out of England, because they say you can manage this without medication. What do you think about that?
I think you can, and I think most of us should. So there are few behavioral things that we should all be doing in order to manage chronic constipation. And we really think about something becoming chronic when you've had less than 3 bowel movements a week for more than 3 weeks. It's time to see a doctor. So if you fall into one of those categories, the first thing to do is obviously some of these behavioral changes. So 6 to 8 glasses of water a day, Alex, are we doing that?
Yes,
Okay.
and I saw my doctor and things were moving along.
Excellent.
But
so that's the
was
first
a time.
step, making sure you stay hydrated because the stool pulls water in. Second step, walking after every meal. That actually stimulates your gut to start moving. And so even if it's a short little 5 or 10 minute walk, you really want to, after you eat, start to walk. Take a little walk. You don't have to exercise, do anything intense, but that really helps things to move along. Obviously, stress reduction and sleep is really important. Fiber, how are we doing with that? 25 to 35 grams a day, both soluble and insoluble fiber.
And I would imagine most Americans not very well is the answer to that question.
Don't do that, exactly. And then we have to try to go at the same time every day. And the best time to go is when our colon is most active, and that's usually right after our breakfast in the morning, because our colon follows a circadian rhythm, a body clock, and the food, the breakfast, actually triggers stretch in the colon that then stimulates things to come out. And lastly, if you're somebody who struggles with chronic constipation, they actually say you should use a footstool so that you actually kind of can prop up your feet and have almost a squatting shape, which makes it easier to evacuate the colon and pass that stool.
So that does work, because I've seen that. I'm like, do I need one of those? But it
works,
legit.
But you don't want to do it for too long, because if you're doing that for 20 minutes and straining, then you're actually increasing your risk for hemorrhoids.
Interesting.
Or, of course, doom scrolling on the phone, as we've talked about before. So it's mostly just when you're just about feeling that urge, but you feel like you just need a little extra to pass it.
With those statistics as high as they are, how do people know when this is actually a problem?
Yeah, so if the duration has been too long, so it's that 3 weeks, and you're having, very few stools. Now, if you start to see blood in your stool, you start to see pencil-thin stools, you start to have abdominal pain with passing stools, or you start to have, weight loss or anything like that, these are all warning signs. Obviously, we most concerned about colon cancer, but there are other things. So these guidelines say that, once you've done the behavioral thing, you can try foods to really help sort of stimulate your gut. So we've talked about fiber. They say you should eat 3 kiwis a day.
Kiwis?
Which is not practical, in my opinion, and 6 to 8 slices of rye bread. These are supposedly a day. And again, you're trading one problem for the other, because it's all these carbohydrates. You're going to bump your blood sugar and all that stuff. So in my opinion, really, these guidelines, even though they're quote unquote evidence-based guidelines, I think really are sort of struggling when it comes to food. Now, supplements, on the other hand, I do think can help you if you're struggling.
Interesting.
We don't have much time left, but we were showing bananas to our viewers. What was that about? Is that one of these foods that will help things move?
It can. So bananas can help stimulate. They have a lot of potassium. They have, fiber in them as well. But certainly bananas can also help people who have diarrhea. So looking at your stool every day and making sure that it's the right consistency. And for kids, we teach them you don't want pellets. You don't want little soccer balls. You want snakes or sausages, and you want soft snakes or sausages. And that's the best way to know if your gut is in the good health.
Yeah.
If you're passing a soft steak or sausage most days, that's really a good sign.
Good to
Now,
know.
stay away from those probiotics, though, because I know that that's one of the things in the guidelines, but I don't actually agree with those because they can disrupt your gut. So repleting it with fruits and natural probiotics is the right way to do it.
Okay, I'm really looking forward to my kiwi and banana sandwich on rye bread tomorrow.
All right, report back to us
I
about
will.
the shape of the stool.
Very
Absolutely.
descriptive.
I
Dr.
will.
Kohli, thank you for that.